Well, more than 5,000 people in New York State remain hospitalized with COVID-19. News Channel 34's Karina Capabianca has more on the challenges the state still faces when it comes to hospital capacity, masks, tests, and PPE.
The vast majority of confirmed cases are downstate, and the governor is working on a plan for potentially distributing the load of patients down the line.
We're working on a collaboration where we distribute the load between downstate hospitals and upstate hospitals, and we're also working on increasing the capacity for upstate hospitals.
But he says that would only be resorted to as the last option.
I'm not eager to redistribute people from downstate to upstate. They're just practical consequences. The family would have to travel further to visit them, etc.
The governor says when it comes to PPE, it's an ongoing issue that the state continues to shop for.
We have enough PPE, and the New York City officials say they have enough PPE for the New York City hospitals.
When he was asked about reports of a lack of PPE in Western New York, he had this to say.
Any hospital anywhere, whatever we have, we'll distribute. And we distribute it on an as-needed basis. So to say I need it in a week and a half, frankly, we're dealing with hospitals that need it tomorrow and the day after. That's the kind of time frame that we're dealing with.
We also asked about when more testing kits could be coming upstate.
Hospitals tend to like to have supplies for a prolonged period of time, which I understand. So they want to have a 1-month supply, a 3-week supply. We don't have that ability. If we can provide a few days supply, that's what we're looking at, which makes them uncomfortable, I understand.
He says the Department of Health can provide testing kits to hospitals that need them immediately, and that there are also mobile testing units. In Albany, Karina Capabianca.
Another challenge is still the need for ventilators. The governor says that the state is working on converting anesthesia machines into ventilators. Now today, both Lourdes and UHS told News Channel 34 that they believe they currently have an adequate supply of ventilators for their current patient volume.